care for 90% of women with invasive cancer. Like it has with so many diseases, the pandemic has caused setbacks to progress towards these targets because of disruption to health services. The proportion of girls globally with access to HPV vaccines has fallen to 13% from 15% before the pandemic. At the same time, there are encouraging signs of progress. In the past year, several more countries have introduced the HPV vaccine into national immunization schedules, including Cameroon, Cabo Verde, El Salvador, Mauritania, Qatar, Sao Tome and Principe, and Tuvalu. WHO has also pre-qualified a fourth HPV vaccine called Secolin, produced by Innovax, which we expect will increase supply and decrease prices. We have also seen innovations like self-sampling, which offers women the option of being screened for cervical cancer without a pelvic exam. Today, we're releasing WHO's evidence generation framework for artificial intelligence-based screening. But we need to do much more. Today, we're calling on all countries, all manufacturers of vaccines, tests and treatments, all partners, and all civil society organizations to join us in our effort to make cervical cancer history. Henrietta Lacks didn't live to see the benefit that her cells have been to so many women around the world. Cervical cancer took her life just a few months after she was diagnosed. We owe it to her and to all women who have died with cervical cancer or are living with it today to make these life-saving tools available and affordable everywhere. Today, we're honored to be joined by 4 First Ladies from Africa who have seen firsthand the impact that cervical cancer has on women in their countries. First, it's my great honor to welcome Her Excellency Janet Kagame, the First Lady of the Republic of Rwanda. Madam Kagame, thank you so much for joining us, and you have the floor. Murakoze Chane, and you have the floor.
Thank you, Dr. Tedros. Excellency Sika Kabore, Première Dame de la République du Burkina Faso. Excellency Tsepo Motsepe, First Lady of the Republic of South Africa. Excellency Neo Masisi, First Lady of the Republic of Botswana. And of course, Dr. Tedros Ghebreyesus, Director General of the World Health Organization. Excellencies, ambassadors, dear engaged partners, dedicated activists, allies, and friends, ladies and gentlemen, good morning, good afternoon, good evening. Thank you, Dr. Tedros, for reminding us that we have people following us from different time zones. I'm honored to be here today, 1 year into our commitment to implement a global strategy to accelerate the elimination of cervical cancer as a public health problem. Fighting a crisis amidst another crisis is no easy feat. I commend the WHO for not pushing women, particularly those from the developing world, to the side as it weathers the storm of the COVID pandemic. By placing concern for people of both genders and of all races and ages at the heart of medicine, the WHO has made commendable headway in devising a permanent solution to the cervical cancer emergency. Distinguished guests, we all know that early detection is by far the most effective method of waning the fatality of cervical cancer. Mass screenings are essential to our mission. Therefore, they should be considered an extension of the human right to the highest attainable standard of life and health conducive to living a life in dignity. Since the introduction of cervical cancer screenings in Rwanda in 2015, over 170,000 women have been examined. I'm confident that by this time next year, new partnerships will have helped raise this number further and will speak to the force of our momentum. Valued partners, devoted activists, allies, and friends, as the conversation between nations shift to include vaccine manufacturing and benevolent research, I hope that this spike in international health consciousness multiplies global resolutions to make cervical cancer prevention accessible to all. Rwanda has already surpassed the target set by the WHO Cervical Cancer Elimination Strategy of having 90% of girls under 15 fully vaccinated for HPV. In fact, since 2011, our immunization of young girls aged 12 has consistently stood above 90%. However, research has emerged in favor of also inoculating young boys against the virus in order to reduce transmission rates. Therefore, our developing nations need to be equipped to double our efforts in the enrolling of vaccines. I join Dr. Tedros in inviting industries, the private sector, researchers, and development partners to work with our governments to reduce the price of HPV vaccines, HPV DNA test, and the adoption of innovative technologies such as the WHO's AI visual examination tools. I hope for an African continent where these vaccines are produced locally with the support of our every ally who I believe shares our vision of health autonomy for all nations. To our women stakeholders, caring for your health must not be a periodic trend. The testimonies of survivors must be consistently amplified. We owe them the promise that their suffering is not the fate that we are allowing for the next generation of women. We owe the family of Henrietta Lacks the faith that the research that we are indebted to her for will lead us to a world with zero cervical cancer fatality. Ladies and gentlemen, a goal of such scale requires ambition from both genders. We owe that this goal cannot be attained with the burden fully resting on women. I again call on our male counterparts to proactively join this fight. This is true allyship in action, sharing our burden to alleviate the load of women as they strive for change that will benefit our entire societies. I thank you, and to more years of commitment partnership.
Thank you, Your Excellency. Thank you for your leadership. It's now my honor to introduce Dr. Sepo Ramaphosa, First Lady of the Republic of South Africa. Dr. Ramaphosa, thank you for joining us, and you have the floor.
Thank you. Thank you, Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, Dr. Nunu Simelela, Assistant Director General of the World Health Organization, Her Excellency Mrs. Janet Kagame, Her Excellency Mrs. Neo Masisi, Her Excellency Mrs. Adjoavi Sika Kabore, Ambassador Sally Mansfield, Ms. Carrie Nakawale, survivors and advocates across the globe, honored guests, ladies and gentlemen, good day. It is hard to believe that 1 year has passed since the World Health Organization strategy for cervical cancer elimination was launched. We applaud the ambitious goal that the strategy sets for lowering the incident rate for vaccinating girls with the human papillomavirus, for screening women using the high performance test, and ensuring that women with pre-cancer are treated and those with invasive cancer are managed. The COVID-19 pandemic has had a profound impact on the program for many institutions, civil society or groups, governments, non-governmental organizations. The pandemic has taken a huge toll on human lives and human health and society. Among other things, we have seen high rates of unintended pregnancies among girls as young as 9 and 10 years old. We have seen high rates of gender-based violence. In cities across the world, we have seen women and their children begging for food at street corners. We have also observed the effects of the pandemic on mental health and people's sense of security and well-being. The disturbing truth is that the poorest, and particularly women and girls, have been the hardest hit. This has implications for our struggle to eliminate cervical cancer. In the same way that access to life-saving vaccines, diagnostics, and treatment for cervical cancer has been severely limited, the unequal access to life-saving COVID-19 vaccines is inexplicable and inexcusable. Unless we more urgently address the inequality in access to life-saving commodities, we will stifle the prospects of the children of Africa and many parts in the developing world and regions across the world. If our efforts fail, we must accept that generational poverty will become entrenched and development will be cut for many years and for generations to come. In such circumstances, the achievement of targets of the global strategies for the elimination of cervical cancer will forever remain a challenge. On the first anniversary of the global strategy, we must acknowledge that much good work has been done in every corner of our country and the continent, and that I commend the World Health Organization and its partners. What we need is a greater sense of urgency, greater equality and strengthened partnership between countries in the Global South and also between the Global South and Global North. We need to recognize the critical role of the advocates and survivors who continue to be the beacons of hope. We will continue to advocate for the provision of comprehensive health services, education and social support for young girls and boys and women across the globe. I wish you well in the weeks ahead and months ahead as we work for a world free from cervical cancer. Thank you for your attention.
Thank you, Your Excellency. Thank you so much for your leadership. It's now my honor to welcome Her Excellency Sika Kabore, the First Lady of the Republic of Burkina Faso, who sent us this video message.
Director General Dr. Tedros Ghebreyesus, Your Excellencies, First Ladies from South Africa, Rwanda, and Burkina Faso, distinguished ladies and gentlemen, good day to you all. It is an honor and privilege to participate at this commemoration of the global strategy towards cervical cancer elimination, a significant moment when Botswana joins the global community to celebrate concerted efforts to eliminate cervical cancer. As we commemorate this day, we should not lose sight of the burden this disease and other NCDs continue to place on the world population, Botswana included. The latest evidence shows that cervical cancer continues to be the leading cause of cancer morbidity at 27% and mortality at 12% in Botswana. This is of particular concern for women who are HIV positive, as cervical cancer is both common and aggressive in this population. For the past decade, Botswana has been engaging at global and regional levels to harness guidance in the establishment of platforms for the effective and efficient screening, diagnosis, and treatment facilities for cervical cancer. All these interventions are geared towards preparing for the elimination of cervical cancer in the future, moving from epidemic control to total cervical cancer elimination. The global strategy for elimination focuses on 3 main areas, which are HPV vaccination, HPV testing, and successful treatment of those women with pre-cancer lesions and effective linkage in treatment of women with cervical cancer. Botswana has made tremendous progress in an effort to eliminate cervical cancer through targeted vaccination campaigns. The HPV vaccine coverage has been above 90% until 2019, when the country started experiencing supply challenges. Scale up to more visual inspection with acetic acid VIA sites is ongoing, with all the 18 regions covering at least 2 or 3 VIA and LEAP clinics. I am delighted to share the progress towards the adoption and implementation of the initiatives entailed in the global strategy for cervical cancer elimination are well underway in Botswana. Efforts to collaborate with Sekitumile Masire Teaching Hospital, which is aimed at research to establish better classification options for management of women with screen-positive results for HPV tests are ongoing. Synergies have been established with the civil society organizations who are key providers of HIV care to incorporate cervical cancer screening and treatment. We have the tools and the knowledge to eliminate cervical cancer. What we do with that is up to us. We can make choices that condemn women to a painful, avoidable death, or we can prioritize their health so that a future generation of women and their families look back with pride at the choices we made today. As I conclude, ladies and gentlemen, I wish to thank WHO for the model leadership, technical guidance, and support as countries commit to women's health, in particular, elimination of cervical cancer. I thank you all.
Thank you so much. Our apologies. That was the video message recorded by Her Excellency Neo Jane Masisi, the First Lady of Botswana. And thank you, Your Excellency. And now we will see the video message sent by Her Excellency Sika Kabore, the First Lady of the Republic of Burkina Faso.
Monsieur le Directeur Général de l'OMS, Mesdames et Messieurs, distingués participants, je voudrais vous remercier pour l'honneur qui m'est fait de prendre la parole en ce jour mémorable, marquant le premier anniversaire du lancement de la stratégie mondiale d'élimination du cancer du col de l'utérus en tant que problème de santé publique d'ici 2030. Le cancer du col de l'utérus est l'un des cancers les plus faciles à prévenir, à diagnostiquer et à traiter. Du fait de l'ignorance et de la faible accessibilité au système de soins, ce cancer fait malheureusement encore de nombreuses victimes, surtout dans les pays à faible revenu. Cette situation révèle les grandes disparités entre le Nord et le Sud et pose avec acuité la question de l'équité en santé. Mesdames et messieurs, depuis maintenant 1 an, 194 pays du monde entier se sont collectivement engagés à mettre fin aux souffrances inutiles que provoque ce cancer. Le Burkina Faso n'est pas en marge de cette dynamique mondiale. De par la volonté politique et avec l'accompagnement de nos partenaires, plusieurs actions ont été entreprises dans mon pays, au nombre desquelles je retiens à votre attention l'instauration de la gratuité du dépistage et du traitement des lésions précancéreuses du col de l'utérus depuis 2016, dans le cadre des mesures de gratuité des soins pour les femmes et les enfants de moins de 5 ans. La réalisation d'une campagne de démonstration de l'utilisation du vaccin anti-HPV chez les filles de 9 à 13 ans en 2014 et en 2015. La conduite de 2 projets de prévention secondaire du cancer du col de l'utérus centrés sur la détection du HPV. Et enfin, la mise en fonction, depuis quelques mois, d'un premier centre de radiothérapie. Le vaccin anti-HPV sera très prochainement intégré dans le programme élargi de vaccination avec l'accompagnement de Gavi. Notons que le monde associatif est fortement impliqué à travers la mobilisation communautaire et le plaidoyer pour l'adhésion des populations. Monsieur le directeur général de l'OMS, Mesdames et Messieurs, la victoire contre cette maladie passe par une action concertée de tous les acteurs de la santé, partenaires techniques et financiers, chercheurs, acteurs de la société civile, organisations de bonne volonté, prestataires de soins, gouvernants et j'en passe. Les actions de lutte doivent être orientées vers le renforcement des capacités nationales, y compris au niveau périphérique, l'amélioration de la fourniture de services contre le cancer, la sensibilisation des populations et la mise en place d'un système de surveillance complet. Le tout sans oublier une bonne gouvernance et le développement stratégique de financement à travers des approches partenariales innovantes. La gestion actuelle de la COVID-19 apparaît comme un bel exemple de solidarité et de développement de partenariats au niveau global. En quelques mois, divers mécanismes ont été mis en place pour faciliter à tous l'accès aux mesures de protection, de diagnostic, de prise en charge et de prévention par la vaccination. Un tel dynamisme gagnerait à être pérennisé au profit du cancer du col de l'utérus. D'autres exemples, tels que le partenariat de Ouagadougou dans la planification familiale, sont également inspirants et disponibles pour être connus et partagés. Je suis donc convaincu qu'avec l'engagement de tous et l'exploitation judicieuse de toutes ces pistes de solutions, nous célébrerons en 2030, dans des conditions plus chaleureuses, le succès de l'élimination du cancer du col de l'utérus en tant que problème de santé publique. Je vous remercie.
Merci beaucoup, Your Excellency, and thank you for each of our First Ladies for your support, commitment, and leadership. The first HPV vaccine was developed by an Australian scientist, Dr. Ian Fraser, and Australia remains one of the leading countries in the global fight to eliminate cervical cancer. We're delighted to be joined today by Her Excellency Sally Mansfield, Australia's ambassador and permanent representative here in Geneva. And we welcome the video message that has been recorded by the Honorable Greg Hunt, Australia's Minister of Health and Aged Care.
I welcome the opportunity to address the World Health Organization, member states and key international partners on such an important topic, the elimination of cervical cancer. Today is an auspicious day, commemorating a year since the launch of the WHO's global commitment to eliminate cervical cancer as a public health problem. I thank the WHO for its focus on this vitally important work and the role they've played in progressing it globally. Australia has embraced the commitment, having championed and led the resolution on the global strategy to accelerate the elimination of cervical cancer with the support of many other member states. And what an achievement it will be to close the door on a cancer that has cut short the lives of far too many women around the world. So how can we get there? Because we can. The tools to eliminate cervical cancer, vaccination, screening and treatment of pre-cancer, early detection and prompt treatment already exist. The next critical step is to scale up the implementation through domestic initiatives consistent with the global strategy. We need to continue to drive greater global efforts so that by 2030, all countries can achieve 90% HPV vaccination coverage, 70% screening coverage, and 90% access to treatment for cervical cancer, pre-cancer and cancer, and including access to palliative care. Australia will continue to work with the WHO to promote the immunisation, screening and treatment programs that have proven so effective at preventing and detecting cervical cancer. We especially look forward to working with our regional neighbours in the WHO Western Pacific region to develop a framework for the comprehensive prevention and control of cervical cancer. In relation to Australia, I'm deeply proud to announce that Australia is on track to eliminate cervical cancer by 2035. Our national cervical screening program continues to be central to preventing cervical cancer through early detection. Now, 30 years old, the screening program has halved the number of cases and mortality rate in Australia. The program screens with a simple test, now done every 5 years with checks for HPV, the common infection that causes almost all cervical cancers. And complementing the screening program is our HPV vaccination program, a vaccine developed in Australia that helps protect young people from getting a range of HPV-related cancers and diseases. Our government has just announced funding that will make self-collection of the sample for the cervical cancer test universally available from July 2022. This is a game changer that gives women control of taking the sample and makes the test more comfortable and less invasive. We've also just invested in the development of a national cervical cancer elimination strategy for Australia by the end of 2022. We are also funding Australia's largest clinical trial, the COMPASS trial, which will produce world-first evidence on the interactions between HPV vaccination and HPV-based screening. It's important that together we maintain momentum and work to fulfil the opportunity available to the world to eliminate cervical cancer. We have both the will and the way to achieve this goal. I once again thank the WHO for its ongoing technical focus on this important work and reiterate Australia's profound commitment to this cause.
Thank you, Honourable Minister, and my thanks to Australia for its leadership and ambition. Finally, we can only eliminate cervical cancer with the voices and advocacy of the women who suffer from this disease. It's therefore my great pleasure to welcome Karen Nakawala, a survivor of cervical cancer and advocate from Zambia. Karen, thank you for joining us, and you have the floor.
Thank you so very much, and I can't believe it's already a year since we launched the strategy to eliminate cervical cancer as a health problem. Please allow me to write on the protocols that have already been observed. Now, each and every day, I'm reminded of the pain, the anguish, the uncertainty of the possibly bleak future as I went through the process, from diagnosis right through to the harsh treatment of cervical cancer. And my first thought was that I was going to die. My greatest fear was leaving my 2 daughters behind, of losing my best friend and partner. However, as I progressed through the treatment, the fears became less and less, and I saw a glimmer of hope. But that brought on new unforeseen fears. I was afraid of losing my femininity. I was afraid of the stigma attached to cervical cancer. I was afraid of what my life would be like after cancer. Would anything be the same at all? And here, the same is actually a very relative term. This is the life of every cervical cancer patient. After treatment, I told myself, and I promised myself, that I was going to fiercely fight to save the lives of my 2 daughters, whom I was so afraid of leaving behind, by advocating for the HPV vaccine for the young girls and screening for the adult women. We have and continue to make strides with screening, but we still need better access to surgery, radiation, chemotherapy, brachytherapy to save more lives. Unfortunately, I have not been able to get my 11-year-old vaccinated, and I have to wait until she is 14. Imagine the disappointment in the young girl when we were turned away after she saw firsthand her mother go through the disease and the debilitating effects of the treatment, and the anguish of a mother who is fighting to save the life of her little girl and prevent her from going through the same excruciating experience. Now, this is the real-time and real-life scenario in most low and middle-income countries, where the vaccine is literally rationed and not readily available in comparison to developed countries where our friends have a choice whether to vaccinate their children or not, despite the abundance and the availability of the vaccines in their countries. There is need for the equitable distribution of the vaccine if we are to eliminate cervical cancer. And by the way, we are all very actively engaged in the elimination of cervical cancer globally, not just in one geographical location. We all know that 19 out of the 20 countries with the highest burden of cervical cancer are in Africa, yet they are the ones with the least access to the HPV vaccine. Until and unless this trend is turned around, the global fight against cervical cancer will remain but a slogan. COVID-19 has brought about its own very serious challenges. While the aim has been to try and keep everyone safe by limiting movement, it means that there has been very limited access to screening services and a very low uptake of the HPV vaccine. In the eastern part of my country, for instance, we are battling with teenage pregnancies. Girls as young as 10 years old are falling pregnant before they can even access the HPV vaccine. The odds are highly stacked against them because of their early sexual debut. By the time they are 20, most of them will have gone through multiple pregnancies and will no doubt be exposed to HIV, clearly making them quite openly susceptible to cervical cancer. Yes, it is imperative that we have the global population, we save the global population from COVID-19, but we need to bear in mind that cancer does not stop. The same efforts we are seeing in trying to end COVID-19, we need to see the same efforts applied to eliminate cervical cancer because it is preventable. When the World Health Organization launched a strategy to accelerate the elimination of cervical cancer, I saw hope. I saw a light at the end of the tunnel. I saw practically a door opening wide towards saving lives. However, this light can and will remain a candlelight flickering in the wind until the HPV vaccine is distributed, accessed, and is readily available for all girls without prejudice between the ages of 9 and 14 throughout the world. In conclusion, for us to prevent and eliminate cervical cancer, there will be need for improved and enhanced cooperation, coordination amongst countries, improved health delivery systems, equitable distribution of vaccines, especially here in Africa, HPV vaccine, which should be accessed at any time by the target audience, improved, consistent, and timely delivery of messages to target audiences, increased awareness on HPV screening and testing, address all visible and invisible barriers to treatment, actively engage cervical cancer survivors and the youth in all the programs that we are going to design to eliminate cervical cancer as a health problem. Low and medium income countries need to be supported in providing better quality services to their patients. We need more survivors, but we can do better by eliminating cervical cancer completely, and we can do it. We just have to work together. Thank you.
Thank you, Karen. You're right. Together we can. Thank you. To lead the next part of our event, it's now my great pleasure to hand over to Assistant Director General Dr. Nono Simelela, who leads WHO's global strategy to eliminate cervical cancer. Nono, over to you.
Thank you, Gigi. Okay, thank you. Thank you for your leadership and your commitment to this very important disease that is preventable, as you've said, that the world has the tools for. Let me thank the excellencies, the first ladies, who continue to show leadership and who are our champions in this fight. Ambassador Sally Mansfield, as well as all the other honorable colleagues who are here, who continue to be partners in the path to the elimination of cervical cancer. So let me greet everybody who has joined us from all parts of the world. A year on, since the launch of the global strategy for the elimination of cervical cancer as a public health problem, there has been important progress. The Director General elaborated on some of the things that we have managed to do working with member states and partners to advance this commitment. Despite the disruptions caused by the COVID-19 pandemic, you have heard how countries have continued to introduce the HPV vaccine and how work has continued in spite of the challenges. WHO has responded to requests for support from our member states with technical assistance, as well as with all the technical products that are available that will support countries in implementation. A number of them are worthy of notice, of being prioritized and also being shared with you all. We've got now country profiles which have been published, which will be extremely helpful to determine baselines across the continuum for countries. We've got as well new guidance specifically for screening and treatment of cervical cancer among women living with HIV who are a particularly vulnerable group. Risk here has increased sixfold for women living with HIV. Therefore, to have a guideline that shows us that we need to screen early, to intervene early, has been extremely helpful. We've got now innovation, as the DG has mentioned, with artificial intelligence and easy tools to ablate and to treat women with pre-cervical lesions. So we are focusing also on helping countries through our partners who are focusing on dealing with advanced cervical cancer, radiotherapy, chemotherapy, and palliative care. So the continuum is intact. The tools are available. The tools are but tools. They need people, they need resources, and they need very dedicated expertise at the delivery level. So we must continue to encourage our healthcare providers to integrate these tools, but also to support them, because there is so much that healthcare providers on the front line need to do. We are extremely excited that the advocates across the world continue to champion this very, very important disease. And I am very, very, very excited that our partners, who also contribute so much through their dedication, through their commitment, are here today to tell us about how they will continue to support this work and their own political commitments, resource commitments, and the things that they will really put on the table to change the narrative on cervical cancer. And here with us today, I am very, very excited and happy to introduce Philippe Duneton, who is the Executive Director of UNITAID, our partners who've done a lot for us in terms of diagnostics and treatment. Over to you, Philippe.
Thank you very much, Dr. Nono. Excellencies, First Ladies, Dr. Tedros, Madam Ambassador, dear colleagues and friends. UNITAID is very proud to be here today and also to have a response.
So do we have to stay right here?
Yeah, yes. This is it. I lost it again.
Yeah.
Yes. So I was saying that UNITAID is very proud to have responded to the call for action for elimination of cervical cancer. And I just want also to have a thought for a friend I lost. She was 34 and died from cervical cancer, leaving 2 kids. And also for all the women who are dying or suffering from cervical cancer in the world. And I think one key word is inequity. I think in that case, it's obvious. 9 out of 10 women who are dying from cervical cancer are in fact from the low and middle income countries. So for us, it's absolutely important. We have invested $60 million of dollars with 2 grantees, CHAI and Expertise France, supporting intervention in 14 countries, in 3 continents. As mentioned, I think that the access to care, in particular in Africa, was a challenge and still a challenge. And I think it's important to say that in real life, it works. In addition to the vaccine, for sure, because we need to have access to vaccine, but test and treat is working. That's our experience. It is organized around the training of nurses, but also the availability of tools. Diagnostic is absolutely key, and detecting the virus directly increase the level of quality of the screening, including self-test. I will come back to that. But also treat, and it can be done in one go, which is also very important. So we have demonstrated that it's feasible in low-resource settings. We have demonstrated that we can decrease the price of the test by 40% and also 50% in the tools used for thermoablation, for example, and it can be done on a very decentralized way. Unfortunately, like the world and we all live this situation with COVID-19, it has been slower than expected. But I can say now that even if we have test more than 2,000 women, we believe that by the end of 2022, we could be on track and to treat over 1 million of women by the end of next year. So it's encouraging. We have seen that even if it was slow at some point, it was resilient. The way the people and the healthcare workers have been trained is absolutely key. We have trained more than 6,500 professionals to do that, and I think that it's absolutely key. The other thing we have learned, even with difficulty here with COVID-19, is the importance of self-test. I think it was mentioned by Dr. Nono, but it's very key because it's a way really to increase access for the woman in a way that self-collection is more easy to do, is also less intrusive in a way. So again, our commitment is absolutely important for us. We still have the goal to have test and treat for around $1 per woman. Of course, with the evolution, I think that you release the guidelines for artificial intelligence as part of the grant. We hope that we can develop that because it will be a key element to achieve this goal. And to finish, I think that I will also say how we appreciate the strong partnership with WHO and partners and the leadership, Dr. Tedros, of your leadership, but also your team, that we are really closely working together. We believe it's important, we believe it's feasible, and we hope that the work that we are doing with your support and in country can also lead to more countries to join the fight and implement test and treat to eliminate cervical cancer. Thank you.
Thank you. Thank you very much for your commitment, Philippe, and your team, and to really help us push the agenda on diagnostics. This is very important because the artificial intelligence-driven tools will be the game changer for many low-income and low-middle-income countries. We have with us today another very good partner, although this is their first foray into the space of cervical cancer. I'd like to invite Professor Ilona Kickbush from FIND. Everybody who works with us knows that this is the Innovation for New Diagnostics, and we hand over to you to tell us more about how you will support us in this fight to eliminate cervical cancer. Thank you, Ilona, over to you.
Thank you very much, Princess, DG, Excellencies, Ambassador, colleagues, and women around the world. It was very bold for WHO to launch this strategy as the COVID-19 pandemic raged, but that is an essential reminder that other deadly diseases don't press pause when COVID-19 emerged. Every 2 minutes, a woman dies from cervical cancer. Those are daughters, mothers, sisters, partners, wives, and friends. We've heard that from other speakers at this meeting today. Every single loss is preventable. Every death is too much. You know that the WHO Global Strategy sets out a clear plan, the 90-70-90 targets, which are ambitious but clearly are achievable. I'm here today representing FIND, the Global Alliance for Diagnostics. Our focus is on the middle target number. 70% of women should be screened with a high-performance test by the age of 35 and again before they turn 45. WHO has rightly made screening a key element of this strategy because early diagnosis means the disease can be cured, which means women's lives can be saved. But as we see with so many diseases, lack of access to testing is robbing women of that chance of an early diagnosis. In low and middle income countries where health systems are weakest and access barriers are highest, 3 times as many women die of cervical cancer than in high-income countries. Many screening programs in these countries are just pilots. Very few countries, most of them in high-income countries, have scaled up to national programs. We heard from Australia, for example, with at least 70% coverage. Reasons are many. They include high prices and out-of-pocket expenses for women, as well as weak infrastructure to support HPV testing, both of which hinder scale-up. Low test demand and uncertainty about HPV test uptake remains a key barrier for large-scale price reduction. But as we see, even removing those barriers will not be enough to guarantee access. Last year, we joined forces with Women in Global Health to gather the evidence on women's access to testing and explore the potential of women as drivers of change in health systems to help close the testing gap that is holding back universal health coverage and health for all. We found that gender norms and roles also play a major yet underestimated part in limiting access to testing. For example, in many cases, women rely on their husbands for money to access healthcare or are not allowed to take time off work to visit a clinic. Bluntly said, a complex cocktail of technical, sociocultural, and economic barriers to testing is seen time and time again across so many of the diseases prevalent in low and middle income countries. Eliminating cervical cancer, ending tuberculosis, defeating malaria and hepatitis, beating AMR, all of these require stronger testing systems that work for everyone of all genders, no matter where they are. Our research also shows that women lack trust in testing services, and many fear the procedures, diagnosis, and stigma, as we heard from survivors. The tests that women specifically need, such as those for cervical cancer diagnosis and screening, are also often not available in low and middle income countries' health systems. These barriers, of course, are compounded for women who are marginalized or are in humanitarian contexts. To achieve the WHO targets for cervical cancer and many other diseases, which means making UHC a reality, we cannot ignore the gender issues when tackling access to testing. Finally, how is FIND leveraging 20 years of experience in diagnostic testing to help meet the targets? A number of existing fine donors strongly support the expansion of our work into women's health, and I personally am delighted about that. And they support our efforts in helping develop gender-responsive and potentially gender transformative national diagnostic and screening strategies. These include Canada, the European Union, the Netherlands, and Norway. In our latest strategy, we commit to improving the health of women and children through testing. Today, we are marking another concrete step on that journey by announcing a new initiative to improve cervical cancer diagnosis and screening using innovative technologies in low and middle income countries. Our work will encompass point-of-care HPV tests, use of digital and mobile technology for screening, and self-sampling approaches to overcome barriers and improve access to testing. Together, we can make sure that everyone who needs a test can get one, that every woman can get a test. Thank you very much.
Thank you. Thank you very much, Ilona, for this very important announcement, which will move us closer to the goals and the targets we have set. Another partner who's going to join us today is Mr. Eric Flotelot, who is working closely with Expertise France, our partners and implementing agencies on the ground. Over to you, Eric.
Thank you very much, Dr. Nono. It's a great pleasure for me to be here. I'm going to speak in French, so you can switch your translation channel. Excellences, Mesdames les Premières Dames, Monsieur le Directeur Général de l'OMS, cher Dr Nono, Mesdames et Messieurs, chers collègues, je suis absolument ravi d'être avec vous aujourd'hui pour ce premier anniversaire du lancement de la stratégie globale de l'OMS pour accélérer l'élimination du cancer du col de l'utérus. Ce qui me réjouit encore davantage, c'est de constater que nous sommes nombreux aujourd'hui à avoir répondu à cet appel, nombreux à avoir décidé de se mobiliser pour éliminer cette maladie dévastatrice. Alors, vous l'avez mentionné, je travaille pour Expertise France, je dirige le pôle Grande Pandémie, qui met en œuvre deux programmes principaux. Le programme Success, qui a été mentionné par Philippe Dunton, car il est soutenu par United. C'est un projet qui vise à intensifier la lutte contre le cancer du col de l'utérus via une approche de prévention secondaire. Mais l'autre programme que nous mettons en œuvre est l'Initiative. C'est une facilité complémentaire du Fonds mondial de lutte contre le sida, la tuberculose et le paludisme. Aujourd'hui, trop de femmes meurent du cancer du col de l'utérus. Je pense que tout le monde l'a déjà dit, mais je veux le répéter. Une femme meurt du cancer du col de l'utérus toutes les 2 minutes dans le monde. Il est donc impératif et urgent d'agir. Prendre du retard, c'est d'autres femmes qui vont mourir. Et il faut prendre aussi en considération le fait que les femmes vivant avec le VIH ont 6 fois plus de risques de développer un cancer du col de l'utérus. Donc, l'engagement de l'initiative pour contribuer plus activement au combat contre cette maladie ne fait pas de doute. Notre objectif est d'apporter un appui à l'innovation, mais également une assistance technique aux pays qui sont récipiendaires du Fonds mondial. Chaque année, nous publions des appels à projets auxquels des organisations des pays éligibles peuvent répondre, qu'elles soient de la société civile, que ce soit des ministères de la Santé, des programmes nationaux ou encore des instituts de recherche. Ces appels à projets ont une visée catalytique. Ce que nous voulons, c'est autoriser un changement des politiques, un changement des pratiques sur le terrain. C'est contribuer au renforcement des systèmes de santé, c'est offrir aussi un meilleur accès aux services de santé pour les plus vulnérables, pour les plus marginalisés. Je vous invite donc à prendre connaissance de ces appels à projets. Les prochains pour 2022 vont être publiés le 1er décembre. Nous avons besoin de projets qui intègrent mieux et partout la lutte contre le cancer du col de l'utérus pour démontrer l'efficacité, démontrer aussi la faisabilité, la rentabilité et la portée des approches novatrices. Mais en plus de ces appels à projets annuels, l'initiative offre à la carte, ce n'est pas nous qui décidons, ce sont les pays qui nous demandent des appuis techniques pour, par exemple, mettre à jour le plan national de lutte contre le VIH en y intégrant bien toutes les co-infections et les comorbidités liées au papillomavirus humain, comme le cancer du col de l'utérus. Ces demandes, elles peuvent être soumises tout au long de l'année. et sont étudiés chaque mois par le comité de pilotage de l'initiative. Je veux terminer en soulignant l'urgence d'agir afin d'éliminer le cancer du col, ce qui pourra se faire seulement par une mobilisation et un engagement de l'ensemble des acteurs du domaine de la santé publique. Nous le savons, le cancer du col de l'utérus se prévient, il se guérit s'il est pris en charge rapidement. Faisons donc en sorte que toutes les femmes puissent être dépistées et traitées à temps. Faisons en sorte que toutes les jeunes filles et que toutes les femmes puissent être vaccinées à temps. Et si je peux me permettre, il est aussi temps que les hommes s'engagent. Ils doivent se joindre à ce combat, ne serait-ce qu'en soutenant leurs partenaires, leurs épouses, leurs mères, leurs sœurs, leurs filles, pour un meilleur accès au vaccin contre le papillomavirus humain, un meilleur accès au dépistage et un meilleur accès au traitement. Je vous remercie.
Thank you. Thank you very, very much, Eric, for that. The next partner who's going to be speaking to us is a healthcare provider who's working in Little Haiti. Ms. Dina Treville represents a landmark collaboration that we have been working on with the University of Miami. University of Miami has just recently been entered into the list of collaborating centers with WHO, specifically for focusing on the elimination of cervical cancer. We've got many collaborating centers, we acknowledge that, but this specific one is important because they have committed to really take forward the work on cervical cancer. And it's important, I think, to see the partnerships at work between such institutions and health providers on the ground. So I'd like to welcome Dina Treville in Little Haiti, who's on the ground working with women. Over to you, Dina.
Princess. On behalf of the Sylvester Comprehensive Cancer Center at the University of Miami, we are honored to be a part of the WHO Collaborating Center for Cervical Cancer Elimination. We look forward to working with WHO in this important global effort to support countries to achieve the cervical cancer elimination targets. As a community health worker, I'm excited to be a part of this movement. For all of the women that we serve in South Florida and beyond, we stand with you. Nosotros estamos contigo. Nous sommes avec vous. And to my sisters in Haiti and across the Haitian diaspora, nous comptons avec vous. Thank you.
Thank you. Thank you very much for that contribution. As I close this part of the day for our work, I just want to mention that we are very excited by the decision by the government of Japan to reintroduce HPV vaccination into their national programs. We know that 12 years ago, they had to suspend the program really on the basis of bad information on so-called adverse events. I just want to refer to the Lancet article that confirms that these vaccines are safe, that they are efficacious, and that we can use them with confidence. So we congratulate that political will, and we just want to urge many other governments to start with this important step. So I just want to thank everybody again and to hand over to you, Carla, for this session.
Thanks so much, Dr. Nono, and thanks to all of our speakers for their remarks. We will now start the Q&A media section of the briefing. If I could just ask you to please enter your name and media outlet and to ask a question, please only one question. And if you can click raise hand icon. And we will only be taking questions related to cervical cancer elimination today, as I mentioned before. So I'd like to just start off with a question that was actually sent to us in advance from Amy Maxman before this presser from Nature. And Amy asked, what are the barriers to catching and treating this disease early? And what are the barriers to getting girls the HPV vaccine? Did the Mexico City policy have a negative effect on cervical cancer or the HPV vaccine rollout? So I'll hand that over to you, Dr. Nono.
Thank you, Carla, and thank you very much for the question. The issues around access and the barriers, there are supply side issues and there are demand side challenges for women across the world. The supply issues obviously deal with the fact that there is very limited access to the technologies that we need, that many low-income and low-middle-income countries are still using very old-fashioned methods of screening women with acetic acid, and nurses have to really be trained very well to do this. This method is not accurate because it really depends on the provider and their ability to see what the results are when they apply the acetic acid. So you've got those challenges, and you also have challenges with sufficient healthcare providers, well trained with the necessary skills to provide this service to women. Demand side issues have been referred to earlier by Karen, a stigmatized disease, a disease that really makes it difficult for women to come into the center and ask for help. It affects a very, very private part of women's bodies, and it's something that we see makes it very, very difficult. We also have challenges with women's ability to leave their homes to come into the services to get care. I would argue that, any policy that prevents access to a comprehensive set of services for sexual and reproductive health is really counterproductive. And indirectly, by putting such a policy, we impact on women's agency. And part of the work that we are keen to see happen is to deal with issues pertaining to women in a comprehensive way. It's very difficult to say to a healthcare provider, deal only with this part, the HIV part. Do not talk about unintended pregnancies, do not talk about access to termination services if the women so wish. So we really want to promote comprehensive approaches, and therefore in an indirect way, such policies really do affect the assumptions, the stance of people, and they affect the ability of providers to just be comprehensive in their approach. So we hope that with all of the changes that are positive, despite the pushback that still continues around sexual and reproductive health services, we will champion on as an institution to support member states to provide comprehensive reproductive health and sexual services across the world.
Thanks very much, Dr. Nono. I know there was a second part to that question about the Mexico City policy. And did it have a negative effect on cervical cancer or HPV vaccine rollout? Would you be able to address that as well? Thanks.
I think of what I was trying to elaborate is that the Mexico gag rule was a step back because it's a small part of the comprehensive approaches that we're looking for. So inadvertently, you do affect uptake of services, because now what you're doing is compartmentalizing women's lives and saying, this part of your problem, we have a policy that says you can't get access, but everything else we can do for you. And that is something that I really believe was negative. We saw in the services, particularly those non-governmental organizations that were beneficiaries of the funding providing these services. So that I sort of lumped the two issues into my reply, because it's really about this comprehensive approach that we want to promote, even as we focus on this preventable cancer. Thank you.
Thank you for that comprehensive answer. Do we have Latika from Sydney Morning Herald on the line? And if so, could you unmute, Latika, and please go ahead and ask your question.
Thank you very much for taking my question. Dr. Tedros and any other members of the panel, I was struck by Australia's Health Minister outlining how Australia is on track to eliminate cervical cancer by 2035. And then so many of your other panelists underlining how 90% of deaths are occurring in the low and middle income countries. So what more do you need or would like to see countries like Australia doing to help redress that to achieve your targets? And are you concerned at all that those things are going to be made more difficult than even your quest for better solidarity in responding to COVID, given HPV is a much more silent killer and it's not highly transmissible like COVID-19?
Thanks very much for that question. Would you like to address that, Dr. Nono? Thanks.
What we expect from countries that have moved so much closer to the target is the support that we have seen come through from Australia, championing the resolution and making sure that we arrive at this first year anniversary. Relationships between countries that have the means, that also have the wherewithal to do this, and countries that are really lagging behind is what we are seeking to achieve. We would like to see more work being done with North-South collaboration. We expect that support and we know that it will come through. I think it's very exciting to hear these new announcements because even within Australia, we know that there are women who still have challenges with access. We're learning lessons from how they are dealing with the indigenous populations because these are part and parcel of the challenges, mainly in lower and low middle income countries. So we look forward to Australia's support, to their example, their exemplar in how you deal with these things. And we have even the professor who DG referred to, who identified and developed this vaccine, working on the expert group. So it's about knowledge sharing, it's about partnerships, it's also about examples for other countries of how you reach the targets to eliminate cervical cancer. So we work closely with Professor Fraser and many others in Australia to help us support other countries. Over to you, DG.
Yes, would any of our first ladies who may still be on the line, would you like to come in here and comment, please? I don't think they're on the line still, but I'm going to hand over to Dr. Tedros now.
Yeah, thank you. Thank you so much. First of all, I would like to thank Australia for its commitment and the announcement also from the minister. I think we need that kind of leadership. I think you associated this with COVID. Of course, COVID is acute and everybody is now focused because it's emergency. And as you rightly said, cervical cancer is a silent killer and it's not really as visible as the emergency we're facing now. But losing 2 women every 1 minute is not a small problem. It's a big problem. But as has been said, most of the countries that are contributing to the deaths are actually developing countries. And as we speak, 80 countries have not started vaccination. And they contribute to 2/3 of the deaths we see now. So going forward, what can countries do and follow Australia's example is one, to take the 90, 70, and 90 target as their target. That's the first thing to do. that we have said already earlier, the 90% vaccination, 70% screening, 90% treatment, and also the 90% palliative care. The first thing should be to own the target, this global target. Then, of course, we know what is needed to achieve this target. And this is, we need the vaccines, we need the test kits, we need the, drugs, and meaning we need resources. So there should be a support from countries and donors and foundations to contribute in terms of resources that could go to, to those products, starting from vaccines, as I said. So it's almost the same as what we're doing now for COVID. We have the 40% target by the end of this year, and we have the amount already known, the amount of vaccines we need to vaccinate the 40%. So we need to approach cervical cancer the same way, related to the target, the resources we need, and then mobilization of donors and those who can afford to support others to provide the support that's needed. And of course, not only from governments, but as I said in my statement, this should be the responsibility of the manufacturers also. We need access to the treatment, access to vaccines, access to the test kits. And the role of the manufacturers is also very, very important. And that's why, by the way, we took Henrietta Lacks as a reference. Her cells are being used, and the cells actually impacted the world in many positive ways. And I think we should remember her, which didn't have a chance to survive because there were no tools. But now, because of her, we have tools. So we owe it to her, and we owe it to the women who are suffering from this disease to provide the support that's needed to achieve the targets we have already set for ourselves. So that's what we need. It's already in the strategy, and we need to make sure that we have the world mobilized to eliminate cervical cancer, and it's possible. Thank you, Carla, and back to you.
Thanks so much, Dr. Tedros. And you mentioned Henrietta Lacks, and in this next section of today's program, we will be hearing from members of Henrietta Lacks's family, so that will be really exciting. So I'd like to just thank all of our speakers today, and also to the journalists who stayed on and joined us. Also, a huge thanks to our interpreters, as always, and we will be sending post-presser links. We've already sent media to our global media list, the press release. And if you have any further questions for media, please do write to mediainquiries with an I at who.int. And now I'm going to hand the floor over to Richard Freeman, who is WHO Advocacy Lead for Cervical Cancer Elimination Initiative. And he will moderate the second hour of today's event in conjunction with Dr. Nono. So Richard, you have the floor.
Thank you. And thank you everyone for joining us. 1 year ago today, we launched the global strategy to accelerate the elimination of cervical cancer. And communities around the world rallied by turning words into action. On this day last year, the countdown to achieve the 90-70-90 targets by the year 2030 began. To mark the occasion, advocates, communities, ministries have again mobilized actions to advance cervical cancer elimination. We'll take you to a number of locations around the world where efforts are underway at this moment. But first, we'll hear from the survivors and advocates. They're the real warriors on the front lines of the fight to eliminate cervical cancer.
How do I describe myself?
I am a mother of two.
I am first a mama to two delicious little kitties.
I'm a mother for 2 kids.
I've got 2 children.
Soy madre soltera. Tengo 3 hijos.
I'm naturally a very happy person.
Busy, always busy.
I'm working in florist.
Vendo tortillas y pupusas los fines de semana.
I live in Masapuka, Zambia.
El Salvador.
Malaysia.
Lusaka, Zambia.
The United States.
I'm a cancer survivor.
I am a cervical cancer survivor.
Since I was small, I thought that there's no treatment for cervical cancer or any other cancers. If anybody with the cancer, they will die.
Para mí era como una película, ¿verdad? Como una pesadilla, porque la verdad yo no sentía nada. Ya al darme cuenta de cuando me dieron resultado de todos los exámenes, pues era una realidad de que sí existía esa enfermedad.
I was diagnosed with stage 2B cervical cancer when I was pregnant with my second baby, my son Arthur. I was completely unprepared.
And I just kept saying, I can't die, because you think of cancer and you think death. I just kept saying to him, please save me.
I told myself, what I'm going through, no other woman is supposed to go through.
The pandemic has underscored for all of us how fragile our healthcare systems truly are. And even more devastatingly, it's underscored how deep our cleavages are in access to quality care. The people who need the care the most are often the first left behind.
Yo tengo una vecina donde ella no quería someterte al tratamiento. Ella me dijo, no, si de cáncer nadie se cura. Y yo le dije, sí te vas a curar. Mírame a mí, yo soy un ejemplo, soy una persona sobreviviente de cáncer. Pues bendito Dios, pues la mujer me hizo caso, mi amiga, y ahí está también, es una sobreviviente de cáncer.
I asked myself, if I don't want any other woman to go through it, then how will I help out the women out there? Given any opportunity that I have, I always want to talk to the woman and let them know that cervical cancer is real.
I was nominated to sit on the Commonwealth Task Force to eliminate cervical cancer. I have partnered with other civil society organizations in the country because I believe that synergy is what is going to help us eradicate cervical cancer.
I'm advocating this issue through all the charity work that I do. For every woman that I speak to, I learn something different. It was very easy for me at the beginning to judge someone who didn't make screening important in their life. But I know now how difficult it can be for some women. And for me, it's all about listening, encouraging and supporting, not judging anyone, just being there for when they need me.
Part of my purpose in supporting this initiative is making sure that every eligible woman receives the same type of care that I was so fortunate to receive in my battle against cervical cancer.
I see the movement creating a lot of traction. I see it creating a lot of conversations, but most importantly, I see it creating a lot of coordination and cooperation amongst countries.
To the parents out there, please allow your children to get the HPV vaccine so that they will be protected. And for the ladies out there, go and get screened yourself. Go and save your life.
Reach out to anyone you care about with the cervix. Tell them to look after themselves.
I would actually stand on top of the world and encourage each and every woman to say, have you had your screening?
Women are the cornerstone and fiber of every society. And so when we lose one woman, it's a whole society that suffers.
Pues me siento una mujer luchadora, con ganas pues de seguir viviendo a pesar de la enfermedad que he tenido. Pero aquí estoy.
And for any woman who is unfortunately experiencing the same or may experience the same diagnosis, let my message release you from the shame that you may feel.
Aquí estoy animando a las personas pues que se sometan pues a los tratamientos.
To my fellow survivors, I'd like to encourage you not to waste your pain. There's a woman out there who's going through exactly what you went through, and they could use your experience.
To leaders and policymakers, what I would say is you're the ones who can make the difference, so do it. There's no price in a life, no matter what your postcode is, where you live in the planet, every life matters. That's what it means to me.
I represent survival in life today. I represent it.
The color for cervical cancer awareness, and now the color for elimination, is the color teal. When we launched the strategy on November 17th last year, out of the darkness of the current pandemic, communities showed our resolve by lighting up monuments in teal. Today, on the first anniversary of that moment, over 100 landmarks in all regions are showing our resolve to eliminate cervical cancer again. In the evening time zones, some landmarks have already begun lighting up, and more coming to your part of the world soon. Let's have a look. This year, the Director General honored Henrietta Lacks posthumously with an award to recognize her life and her legacy. Henrietta Lacks died of cervical cancer in 1951 in Baltimore at a time of legalized racial segregation. She was exploited when her HeLa cells were taken without her knowledge, but through her cells she left behind a contribution that changed the world, allowing for countless medical innovations. The Lacks family is back with us today, and they're mobilizing action for cervical cancer elimination in their community. We'll now go to Baltimore to her great-granddaughter, Veronica Robinson, who's with us on the line.
I join you from the lab, where I honor my great-grandmother's legacy and her HeLa cells from the bench side. Her cells have not just had an impact on our family, but has had an impact on the world. From polio, HIV, COVID, and HPV, even IVF, my great-grandmother has had a huge impact on the world. As we continue to celebrate our Henny, the mother of modern medicine, through HeLa 100, the Henrietta Lacks family-led initiatives has 4 objectives. Celebration. Help us celebrate my great-grandmother, Henrietta Lacks' legacy by reclaiming her story, 100, to ensure her contributions are recognized and the impact of her HeLa cells are honored, not just in our family, but worldwide. Conversation. Through HeLa 100, the Lacks family-led initiatives, we've been facilitating conversations to educate the next generation on Henrietta Lacks' impact by amplifying trusted voices while advancing diversity, equity, and inclusion. Collaborations. The Lacks family, we believe that we should collaborate to educate and empower patients, providers, and policymakers to improve our outcomes globally and increase access to the innovations made possible by my great-grandmother, Henrietta Lacks, and her HeLa cells. Mobilization. mobilizing through the arts, advocacy, education, and science to honor Henrietta Lake's legacy around the world while promoting health equity and social justice. And next, you'll be hearing from my sister, Victoria Baptiste, our family's first RN, frontline worker, who will be joining you from the bedside.
Today on Cervical Cancer Elimination Call to Action, I will be using my call to action here as a nurse in the clinic. I'm educating my patients on cervical cancer screening, as well as treatment and HPV vaccines. This year marks the 70th anniversary of the HeLa cells, and the Lax family went on a worldwide tour honoring her legacy through arts, advocacy, education, and research. We launched in Bristol with a statue unveiling. We had conversations with Her Excellency, Dr. Sinkafi Bagudu and Dr. Amina Abubakar Bello, as well as Karen Nakawala of the Teal Sisters in Zambia. We then went over to be honored with a wonderful award in Geneva with the WHO. And today, the Lax family is proud to announce the first steps to eliminating cervical cancer. We will be hosting a listening summit, including survivors, providers, caregivers, community leaders, patient navigators, and clinicians like myself to listen, learn, and identify barriers and solutions. So I want to turn it over to my cousin, Alfred.
My family is honored to join the World Health Organization because we know, and no woman should be denied, these vaccines that were created by the HeLa cell. And the Lax family is demanding access for all women, all girls, all boys, and all communities around the world. We all stand together in solidarity to eliminate cervical cancer once and for all.
And Veronica's on the line with a few words for us. Veronica Robinson, Henrietta Lax's great-granddaughter.
As you just seen, it's been a remarkable year for us. Thank you to Her Excellencies, Dr. Tedros, Dr. Nono, and Richard. On behalf of Henrietta Lake's family, we are honored to be here today, again, with our friends from the World Health Organization, global leaders and advocates on this Cervical Cancer Elimination Day.
Thank you. Thank you, Veronica, and thank you to the Lax family. Now, we'd like to go around the world and share a look at some of the Day of Action activities that have been unfolding to mark 1 year of cervical cancer elimination effort. And we're going to begin with the Western Pacific region, but to get us started, I have the honor of giving the floor to the Ambassador of Australia, Her Excellency Sally Mansfield, for a few remarks.
Thank you very much indeed, Dr. Tedros, distinguished guests, women and girls everywhere, in particular, health workers, colleagues. Australia is really proud to be here to reiterate our support for cervical cancer elimination worldwide. This is a time of immense challenge, particularly for women and girls who have suffered the greatest burden as a result of the pandemic. We've seen health systems around the world disrupted as never before, and we must work together to ensure everyone gets the best health services possible, and that has to include prevention and early detection of cervical cancer. Cervical cancer is still one of the most common causes of cancer-related death in women across the globe, with incidence nearly twice as high in low and middle-income countries and death rates 3 times as high. But it doesn't have to be like this. Australia's achievements show that eliminating cervical cancer is an attainable public health goal. Since we started national screening back in 1991 and rolled out HPV vaccination in 2007, Australia has halved the number of women who die from this insidious disease, and we're on track for elimination by 2035. As the Director General and the other eminent speakers before me have emphasised, we have the knowledge, we have the tools to stop women suffering and dying from this preventable disease. This is why Australia supports so strongly the development of the global strategy and why we are working so hard to implement it. We know where the highest burden of cancer sits. It sits in the developing world. Within Australia's region, the Indo-Pacific countries, Australia is working to implement the WHO global strategy with partners including UNFPA, IPPF and Gavi to strengthen services and support the regional rollout of HPV vaccines. We've just heard from a number of fabulous women who have survived. They're speaking out, they're speaking up, and that makes these women extraordinary. If we seize the opportunities that are within our reach now, girls who are born today, girls who are born this year, will live to see a world free of cervical cancer. Let's make this our legacy. And as Dr. Tedros said, together we can. Thank you.
And now we'll see some of the activities that are happening today in the Western Pacific region.
On behalf of Malaysia and Rose Foundation, I'm very pleased to be able to share with you all the community effort and how we as Malaysians have come together to celebrate the first anniversary of the global strategy to eliminate cervical cancer. The first anniversary of the global strategy to eliminate cervical cancer, and on behalf of Lions Club we have created this huge event down in the Rumah Hotel in Kuala Lumpur in conjunction to celebrate this very important event that should have more self-love in themselves, with their minds and with their body, and what better way than to do this self-testing HPV for eliminating cervical cancer. In the coming years, in the coming months, what we hope to do is to continue to implement program roles with strategic partnerships, not to reach out to women all over Malaysia.
In conjunction with the celebration of the first anniversary of this movement, Malaysia is working towards a cervical cancer-free nation with the National Action Plan getting lined up.
While we focus on cervical cancer elimination, we also must not forget the physical pain and suffering that the disease brings. Yet many patients lack access to the palliative care that WHO's elimination strategy calls for. So to commemorate 1 year of this effort, Smriti Rana, a palliative care advocate with Pallium India, advocates at CAPED, and many others, along with cancer survivor Poonam Bagai, organized an effort among the caretakers of cervical cancer patients. To reflect on the importance of mitigating the pain of their loved ones, they shared this message today.
How can it be that the first and most effective line of defense against one of the deadliest and most painful cancers is the simple act of knowing? Cervical cancer in India is not a disease of only the impoverished. It is a disease of the unaware. Privilege and poverty both fall prey to it. And for each life afflicted, there are caregivers affected. Stigma around this cancer leads to silence. And the silence is lethal. It claims the lives of more women than any other cancer. It ravages their bodies and lives in ways inexplicable. This need not be, but it is. Palliative care can help if only one knew to ask for it. It is the only kind of cancer in the world today that has not one, but 2 vaccines that can completely prevent it. It can be easily screened for, and if caught, can be stopped in its tracks. But great science, without awareness, cannot overcome this. Let's take back the spaces cervical cancer has claimed. Let's honor these faces who are living and dying with it.
The message indicated 2 HPV vaccines, but as we noted earlier in the press conference, there are more options globally. We'll now move to the Southeast Asia region, where Sutapa Biswas at Cancer Foundation of India shares an update on some of the progress made in and around Kolkata in this first year. And Dr. Nirja Batla, a member of the Director General's expert group for cervical cancer elimination, will share some exciting activities happening today for the Day of Action.
How can it be that the first and most effective line of defense against one of the deadliest and most painful cancers is the simple act of knowing? Cervical cancer in India is not a disease of only the impoverished. It is a disease of
I think shall we proceed? Okay.
of the unaware.
We'll return to this. So to continue, it's now my great pleasure to introduce an extraordinary champion for women and children all around the world, 4-time Grammy Award winner and UNICEF Goodwill Ambassador, Angelique Kidjo.
Excellencies, Minister, and everyone joining from around the world. 1 year ago, we were together for a historic moment when the world committed to eliminate cervical cancer and to stand up for women's health. This is a time to remind each other of how important it is to stay the course. I am encouraged by the Day of Action today in countries all over the world, even during the pandemic. And I salute the brave cervical cancer survivors who have shared their stories and advocate for their sister. Women like Karen, Mazugio, Eve, Nanthini, Kanchan, and Obiageli. This has also been a hard year. The pandemic has prolonged many disruptions to health services, to livelihoods, to schools. It is a further injustice that the tools to stop the pandemic have not been shared equitably with many African countries. When it comes to women's health, that is especially troubling. Even before COVID, of the 20 countries with the highest burden of cervical cancer,
privilege and poverty both fall prey to it. And for each life afflicted.
Okay. We'll continue to West Africa, starting with a cervical cancer awareness campaign that's taking place.
19 of them were already in Africa.
Are we ready? Okay. We'll come back. And in the meantime, let's continue to West Africa, where cervical cancer awareness campaigns have been taking place over the past few days, including today, and one campaign in Ouagadougou's main market, where the ministry and several partners of the Success Consortium have been mobilizing efforts.
Ce que je à nos femmes, à nos sœurs, à nos mamans, c'est de se faire dépister régulièrement. Dans tous les centres de santé du Burkina, le dépistage se fait. Parce que depuis avril 2016, le gouvernement a décrété la gratuité du dépistage et de la prise en charge de ces lésions précancéreuses. Le cancer du col de l'utérus, j'aime à le dire, c'est un cancer gentil. Pourquoi? Parce qu'il n'apparaît pas cancer brusquement. Il commence par la lésion, comme je vous ai dit, et qui va mettre au moins 15-20 ans avant de devenir un cancer. Donc le cancer du col de l'utérus, on peut l'éviter. En ce qui concerne Jipaigo, il y a un projet nommé Success qui est donc étendre l'élimination du cancer du col de l'utérus. Et nous avons ciblé 6 régions avec 21 sites où nous allons déjà mener à bien ce projet en dépistant les femmes, en recherchant d'abord le virus qui est à la base donc, du cancer, le HPV.
L'élimination des cancers passe par la communication. Et nous avons insisté sur la bonne communication. La bonne communication, c'est celle qui se fait dans la langue que les femmes comprennent et c'est celle qui se fait également sur les lieux où les femmes se trouvent. Et je crois qu'il n'y a pas un lieu qui réunit plus de femmes que le marché Rodoko. Cela a guidé notre choix de ces lieux. Le bilan que nous pouvons tirer, il est positif. Il y a beaucoup d'associations qui interviennent dans la lutte contre le cancer du col de l'utérus. Mais avec ce lancement, avec l'aide de nos partenaires, je veux dire Jaspirgo, avec l'aide de nos partenaires, l'Union internationale contre le cancer, nous avons pu former au Burkina ce qu'on appelle la coalition burkinabé contre le cancer.
This is the team from the Cervical Cancer Prevention and Training Center in Catholic Hospital, Bato, Ghana. We are happy to celebrate with the World Health Organization the first anniversary of the launch of the strategy to eliminate cervical cancer. We would like to use this opportunity to demonstrate to the whole world that it is possible to use current technology to reach out to women in the most deprived communities in the world. We shall be using current technology like self-sampling for HPV DNA testing, mobile colposcopy, and thermal coagulation to demonstrate that it is possible to reach out to these women.
In 2020, on November 17th, the WHO launched its elimination for cervical cancer strategy. And this year, for the commemoration of that launch, we are doing a series of programs And this town hall meeting is one of those such programs, all aimed at achieving the aim of that WHO elimination strategy. The vision is a world where cervical cancer is eliminated as a public health problem. If a person is screened and you are able to detect either the HPV or the precancerous changes that are occurring, you can actually treat the woman at that particular point, thereby eliminating the chance of her developing cervical cancer. So as stakeholders, your buy-in here is very important to ensure our children get vaccinated and are protected from not only cervical cancers, but from other HPV cancers. Prevention and early detection of cancer remains the best chance of survival and must be encouraged. So we need everybody to join hands so that we can save more lives.
And now we'll return to Angelique Kidjo, UNICEF Goodwill Ambassador.
Excellencies, Minister, and everyone joining from around the world. 1 year ago, we were together for a historic moment when the world committed to eliminate cervical cancer and to stand up for women's health. This is the time to remind each other of how important it is to stay the course. I am encouraged by the Day of Action today in countries all over the world, even during the pandemic. And I salute the brave cervical cancer survivors who have shared their stories and advocate for their sister. Women like Karen, Mazugio, Eve, Nanthini, Kanchan, and Obiageli. This has also been a hard year. The pandemic has prolonged many disruptions to health services, to livelihoods, to schools. It is a further injustice that the tools to stop the pandemic have not been shared equitably with many African countries. When it comes to women's health, that is especially troubling. Even before COVID, of the 20 countries with the highest burden of cervical cancer, 19 of them were already in Africa. We cannot allow disparities to widen even more. Eliminating cervical cancer means fighting back. It means rejecting the status quo where women in Africa continue carrying the heaviest burden of cervical cancer. Rejecting the notion that African girls have less access to the HPV vaccine. Rejecting a world where women in Africa are screened for cancer with lower quality techniques, even when high-performance tests are available in the global north. This is not just a dream. A higher standard of health is attainable. The Universal Declaration of Human Rights states that all human beings are born free and equal in dignity and rights. This movement is about women's rights. It is about restoring women's dignity. And it is about giving all girls a future free from the one cancer we have the tools to eliminate. We just getting started. And now I'm happy to take you to the countries in Africa where today communities are mobilizing effort for cervical cancer elimination.
Muraho, warm greetings from Rwanda. Over the past year, Rwanda has worked to increase access to cervical cancer screening with HPV DNA testing and visual inspection with acetic acid, as well as treatment of precancerous lesions through training of healthcare providers at hospitals and health centers. The facilities have been equipped with treatment devices and electronic patient tracking tools. Furthermore, community health workers have been trained to conduct demand generation activities and follow-up of women with pending clinic visits. With the increase in cervical cancer screening and treatment service availability in the country, we have been able to screen 177,000 women and treated 87% of the women who were eligible for treatment. To commemorate the first anniversary of the Elimination Strategy launch, we are conducting screening activities in all health facilities of Rusizi District and cervical cancer awareness through billboards, radio talk shows, and the broadcasted screening of Ministry of Health and Rwanda Biomedical Center personnel. This year has taught us that the elimination of cervical cancer requires a multisectoral approach. Going into the second year towards elimination, we will focus on expanding access to cervical cancer screening and treatment of precancerous lesions to all districts across the country, and improving access to quality management for women with invasive cancer. Thank you. Muraweho. Goodbye.
My name is Dr. Mary Nyangasi. I head the National Cancer Control Program in Kenya. Kenya has embraced the call to eliminate cervical cancer as a public health problem, and we are working towards achieving the target set by WHO. So far, we have a national vaccination program that is targeting girls 10 to 14 years, and we are working towards improving this coverage further. We also are training our healthcare workers on screening and treatment of precancerous lesions. We have provided these healthcare workers with treatment devices. We have trained nearly 6,000 healthcare workers on cervical cancer this year alone. We are also training our community health volunteers on cervical cancer and teaching them about the self-sampling techniques using the HPV kits, so that they're able to educate our women in the communities and provide them with these kits for screening at the comfort of their homes.
Today, November 17th, marks the first anniversary of the launch of the Cervical Cancer Strategy on the elimination of cervical cancer as a public health problem. Malawi joins the world in this commemoration. In light of our commitment that we made in 2020, Malawi revised its cervical cancer strategy, which will run from 2022 to 2026. In that strategy, we have advocated for increased allocation of resources. Also, there's been expansion of screening and treatment of cervical cancer. We also have started implementing the human papilloma virus screening, and this is being done in 13 of its facilities. But we have more facilities, and there will be need to keep on scaling this initiative. There has been task shifting of the large loop excision of the transformation zone, LEADS, which we have expanded from tertiary facilities to secondary facilities. In collaboration with our partners, CHAI, Health Policy Plus, and the Association of Obstetricians and Gynecologists of Malawi, AOGM, we developed a curriculum on LEADS, and we have trained over 29 clinicians across the country. With these efforts, we believe there is going to be increase in terms of screening, but also management of the large lesions. So women are going to access these services, and we reduce the burden of cervical cancer. I thank you for your attention.
In this inaugural year of the global effort to eliminate cervical cancer, The Commonwealth and UICC launched the International Task Force on Cervical Cancer Elimination in the Commonwealth. The task force is committed to engaging youth. They're a critical part of this effort. So to highlight their role, we'll now go to just a short message from Gideon Gashihi, a youth representative of the task force, who shared this message from Kenya today. Okay, we can proceed in that case while they resolve the technical difficulty, and we can move on to the activities in the European region. We'll start in Europe with also with some young advocates. They are organizing around today's Day of Action, and they formed a youth group of teenagers to mobilize around HPV awareness and cervical cancer elimination. To Europe.
Hi everyone, my name is Celine and I'm the leader of Engaged Teens. My personal goal within this youth organization is to destigmatize sexual health, as well as taking an active role in our education and knowledge about HPV and cervical cancer. Our involvement is so important because we believe that teenagers will listen and care more if they see that members of their own generation are concerned about these topics. For example, my friends take cervical cancer so much more seriously since I've shared the steps I've taken in my health to prevent it. For example, getting the HPV vaccine. We encourage you to get the youth's voices in your countries more active in this conversation because we feel that just eliminating one cancer can be the beginning of the end to all cancers.
Hi, I'm Vanda and I'm from Hungary. Happy Cervical Cancer Elimination Day. In the 1 year since WHO has launched Cervical Cancer Elimination Initiative, an organization called Engaged Teens has been launched in Europe to advocate for knowledge about HPV and cervical cancer prevention. I find involving teens crucial because the sooner we start prevention, the more effective it will be. This is a huge step for cervical cancer eradication because now we are getting involved in promoting awareness and starting conversations as the next generation. We are now taking an active role in enacting change for ourselves and our friends so that in the future we can say that we beat cervical cancer.
Dear Dr. Tedros, dear Princess Nono, dear activists from all over the world, this is a very important day. Today we celebrate the 1 year anniversary of the first global commitment ever to eliminate cervical cancer. Thank you, Dr. Tedros, for your strong commitment on women's health. Thank you very much for your strong commitment against cervical cancer. As you know, I share the same commitment and the same ambition as you, as a gynecologist, as an activist, but also as a member of the European Parliament. And I have, my dear friends, some good news to share with you from Europe. In the past year, we have made 2 ambitious commitments. Firstly, to vaccinate 90% of girls against HPV by 2030. And of course, to increase also the vaccination of boys. And secondly, to offer screening to 90% of European women. We must continue to support WHO and all the partner countries to achieve the global strategy. Every country, every region, every continent, all together we can beat cervical cancer. We have 9 years ahead of us. We have all the elements to be successful. Qualified doctors and nurses, patients, survivors, researchers, advocates, and fundraisers. We have the medical tools. Now we have a very, very strong political commitment. So let's work together, my friends. This is a fight for women's health, and this is a fight for women's rights.
We'll now return to the message from Gideon, the young clinician in Kenya from the Commonwealth Task Force, who has been working on youth activism around cervical cancer elimination.
My name is Gideon Bashir. I'm a Kenyan youth. I am also a clinician here at Thika, level 5. I am also privileged to be a member of Commonwealth Cervical Task Force, where I'm involved in advocacy and advocating for more programs towards the fight against cervical cancer. So as a youth, together with my group, who are based here in Kenya, we are mainly involved in activities such as sensitization of women against cervical cancer. We are also actively involved in the process of administration of HPV vaccine against young ladies. Being a clinician, I'm also privileged to be involved in the treatment of cervical cancer patients.
We urge all stakeholders to come together as we commemorate this great day, the fight against cervical cancer. So, together, we fight cervical.
Okay, we'll now continue to move across the world and see some of the activities that have been happening in the Americas region, where some of the submissions are sharing a look at what's happening today on the Day of Action, and also a look back at a few of the highlights during this inaugural year in countries in the Americas.
Sus Excelencias, Dr. Tedros y todos los que se unen desde diferentes partes del mundo. Hoy hace un año, el mundo se unió para acabar con el cáncer. Eliminar el cáncer cérvico-uterino es una misión ambiciosa, pero tenemos las herramientas para hacerla realidad. En este hito, nosotros aquí en la Universidad de Miami estamos sumamente orgullosos de unirnos a la Organización Mundial de la Salud para anunciar una nueva alianza en este esfuerzo global. Hoy inauguramos el primer centro colaborador de la OMS para la eliminación del cáncer cervical, el cual se ubicará en una de las más prestigiosas áreas de la Universidad de Miami, el Centro Integral de Cáncer Silvestre en nuestra Escuela de Medicina Miller. Desde la encrucijada de América Latina y el Caribe, compartiremos investigación y experiencia para ayudar a las comunidades de todo el hemisferio y de todo el mundo a perseguir la eliminación de este cáncer prevenible y curable. Para conmemorar el día, continuamos nuestro trabajo con socios locales para apoyar los servicios gratuitos de prevención del cáncer de cuello uterino para las comunidades marginadas aquí en Miami. Nuestro trabajo recién comienza y estamos comprometidos a ganar esta lucha.
I'm Craig Earle, CEO of the Canadian Partnership Against Cancer. The Canadian Partnership Against Cancer is excited to be celebrating the first year of this historic global commitment to eliminate a cancer. Last year, we launched Canada's action plan to eliminate cervical cancer in conjunction with the global strategy. The action plan is Canada's roadmap to improve HPV immunization rates, transition to HPV primary screening, and enhance follow-up practices. Efforts to implement the action plan are now underway. Over the past year, the majority of provinces in Canada have initiated plans to move from Pap testing to HPV primary screening with the option of self-collection, making screening programs more effective, resilient, and easier to access. We're also working with public health partners to better identify under-immunized populations and redesign HPV immunization programs, which vary greatly from coast to coast to coast. Shifts in service delivery are also taking place in Canada. As one example, our Yukon territory has expanded access to HPV immunization by offering it free in pharmacies to anyone up to the age of 26. The Canadian Partnership Against Cancer is working with partners across the country to drive this work forward and is committed to taking action to create a cervical cancer-free future. To help mark this special occasion, the 3D Toronto sign behind me, along with other major landmarks in Canada, will be lit up in teal later on tonight, so you can keep an eye out for that.
Soy Carolina Biesner, directora del Instituto Nacional de Cancerología. En Colombia estamos comprometidos con la eliminación del cáncer de cuello uterino como una meta a largo plazo. Tenemos incluido la vacuna dentro del Programa Nacional de Inmunizaciones y esperamos recuperar la cobertura de vacunación en este periodo post-pandemia. Tenemos las guías de atención integral para el control del cáncer de cuello uterino y allí está incluida la tamización con virus del papiloma humano. Ya muchos aseguradores han iniciado con esta tamización. Y por supuesto, las mujeres que tengan lesiones preneoplásicas o cáncer tienen acceso universal a la atención para esta situación.
Mi nombre es Carlos Humberto Pérez Moreno, soy el director general del Hospital de San José de Bogotá y presidente actual de la Federación Internacional de Colposcopia y Patología del Tracto Genital Inferior. Hemos trabajado de la mano con el Instituto Nacional de Cancerología y la Federación Colombiana de Ginecología y Obstetricia FECOLSOC en todo este tema de la prevención del cáncer cervicuterino. En el tema de vacunas contra el virus del papiloma humano, hemos fomentado su vacunación buscando que lleguen a los niveles prepandemia. Muy importante el tema del fomento de la vacunación que hemos hecho a través de nuestras sociedades e igualmente todo lo que tiene que ver con tamización con pruebas moleculares, que hoy en día es la norma para la tamización en nuestro país. Es bien importante que los pacientes conozcan, exijan la prueba, que vayan a tomarse la prueba y que posteriormente, de acuerdo a estos resultados, acudan a nosotros los ginecólogos, quienes somos los que vamos a dar un adecuado diagnóstico y tratamiento de todas las enfermedades preneoplásicas para evitar que las pacientes lleguen a tener un cáncer cervicuterino. Entonces, a través de las federaciones estamos comprometidos con el país, estamos comprometidos con Latinoamérica en la prevención del cáncer de cuello uterino. Muchas gracias.
Hola a todos, soy la doctora Alicia Pomata, directora del Programa Nacional de Control del Cáncer del Ministerio de Salud de Paraguay. En un video que les preparamos, les mostramos algunas de las actividades que llevamos a cabo durante el primer año del Plan de Eliminación del Cáncer de Cuello Uterino 2030 de la OPS. Pueden ver nuestra región piloto y nuestros colaboradores trabajando arduamente en lograr este plan. Y todavía hay mucho más por venir.
We now have a very short message from Mrs. Obiageli, a cervical cancer patient in Nigeria, which she actually shared with us just a few days ago. So we'll go to listen to her brief message, and then we'll hear from the co-chair of the Director General's expert group, Professor Grossbeck Parham, who's with us live on the line following this clip. Thank you.
You mean going that extra mile to survive this sickness? To see that I'm healthy and jump over this sickness so that I will not die and leave my children orphans. I reject it. I'm calling other women. I'm calling other people that we should come together for ourselves. Fight it, we survive it.
the co-chair of the Director General's Expert Group, Professor Grossbeck Parham. The floor is yours.
Thank you, Richard. Thank you for the opportunity to be here. Thank you for the opportunity to be here and to participate in this wonderful program. Women like Obligelli, who incidentally, who we just saw on video, but who incidentally died from cervical cancer 2 days ago. Women like her are still dying by the hundreds of thousands each year. And in her own words, which maybe you didn't hear, in her own words before she transitioned, I think she provides us with wise counsel. And I quote, this is what she said: "I'm calling on other women, I'm calling on other people to come together to help ourselves. If we fight it, we will survive." And I'll repeat that. She said, "I'm calling on other women, I'm calling on other people to come together to help ourselves. If we fight it, we will survive." I think if there's one thing we have not emphasized enough in the fight to eliminate cervical cancer, is that we, and I count myself among the we's because I've been living and working in Zambia for almost the past 20 years, fighting against this disease. If there's one thing we have not emphasized enough in the fight to eliminate cervical cancer, is that we as workers on the front line of cancer care in high disease burdened countries have spent too much time looking outside of ourselves for solutions rather than looking within ourselves. We know we have weak health infrastructures, but as healthcare workers, we can do some of the work, a large part of the work, to strengthen these healthcare infrastructures. We can train one another. There are not many of us, for instance, on the continent of Africa, who know how to perform radical surgical procedures for women with early stage cancers, cervical cancers, but there are enough of us. There are enough of nurses who now are experts in cervical cancer screening to train other nurses. We can establish regional centers of radiation therapy. Every country does not necessarily need to have a radiation therapy center. That has failed, and it will probably always fail because the equipment is too expensive to purchase and too expensive to keep up. But we can come together as healthcare workers in these countries and establish regional centers of radiation therapy. We can also come together and organize ourselves and generate the resources, some of the resources that we need to actually build hospitals and build clinics that we need, instead of always looking outside for donors to do so. We understand the culture, and we know how to increase demand for screening women and among men. We can also form organizations of frontline providers, doctors, nurses, etc., to go to pharmaceutical companies and other corporations and ourselves lobby for vaccines at lower prices and other equipment and supplies that we need to provide the services for the women and girls in our countries. Women's groups, men's groups, church groups, etc., need to look these are local organizations I'm talking about in each country, need to look within their own organizations and find ways to initiate the types of activities that will help lead to the expansion of the services that we need to eliminate this disease. So my call is her call, that we need to look within ourselves, that the women in the countries and across the globe need to stand up for their sisters with our help, our assistance, but we need to look within for many of the solutions and do more ourselves instead of looking without. Thank you.
Thank you, Prof. To close out the day, we now have a very special performance from some of Ireland's toughest cancer warriors, the Sea of Change Choir. This group of women cancer survivors are even in the Guinness Book of World Records for their extraordinary advocacy. Let's go now to the RTE News Studio in Dublin, Ireland, from where they'll be sending their message.
Greetings from Dublin, Ireland, where in a few moments you will hear a wonderful performance from the Sea of Change Choir. This choir is made up of a group of very brave Irish women who've been affected by cancer. And for the past few years, they've been performing all around Ireland, raising awareness of cancer and raising almost €1 million to help fight childhood cancer. They've even performed in the European Parliament. Along the way, these women have been an inspiration for so many cancer patients, survivors and advocates, and we congratulate them and thank them for all their efforts. Sea of Change Choir is delighted to be part of the World Health Organization's global effort to eliminate cervical cancer, which affects nearly 600,000 women every year. Today, this amazing group of women, directed by Ian Brabazon, will perform the very aptly titled Times Are Tough, But So Are We, written by Irish songwriter Paddy Casey. I'll hand you over now to Deirdre Featherstone, one of the founding members of Sea of Change.
Thanks, Eileen. Welcome to the Sea of Change Choir, a choir full of cancer supporters and survivors. We are so humbled to be with you here tonight. A few years ago on Ireland's Got Talent, our 44 members in the choir, with 79.5 boobs, bared all, showed our scars and said, "This is the moment that this is me." So today we are so honoured to be talking to the world, and we want to say no more. And we really remember our 3 girls that we've lost in the last year within our choir. Thank you so much, and I hope you enjoyed the performance.
Hi, I'm Hazel and I'm a cervical cancer survivor.
Hello, my name is Mary and I'm a cervical cancer survivor.
Hi, I'm Siobhan and I'm a cervical cancer survivor.
Storm has gathered on the land. Who knows what will fall and what will stand? We'll preach our destruction, talking rivers. We'll say that we're done, but we're not over yet. Well, times are tough, yeah, times are tough, yeah, times are tough, but so are we. So are we. So now we have to pull it down and start it all over again. We will rise from these ashes and stronger. We will dance in the weeks where our sorrows used to be. 'Cause times are tough, yes, times are tough, yes, times are tough, but so are we. So are we. So are we. So are we. We are standing in a row with our backs against the road, never knowing if we will, but we're never losing hope. They may think that we're defeated, but they don't know who will be. We have to wait and see. So let the trumpets in our hearts sound out. Let the laughter in our faces where our sorrows used to be. 'Cause times are tough, yeah, times are tough, yeah, times are tough, but so are we. So are we. So are we. So are we. So are we.
a stunning end to a beautiful day. I hope we take inspiration from the Sea of Change, from all the advocates that we heard speaking today, and we continue in our own little way to move the needle forward. WHO has done a lot, but there's much more we can do. So I just want to say thank you to everybody who's been watching, to the advocates, to every effort that's gone into this anniversary. The women, the girls, and the world will acknowledge your work. Thank you very much.